Hey, Mike Gooden with Reduced Risk Retirement again here, and we're going to finish up our Medicare discussion in this video with an in-depth look at the differences between Medicare Advantage plans and Medicare Supplement plans. They are very, very different. They work very differently from each other. It's important to know the differences so you can make the best decision as to choosing which plan is going to work the best for you. So let's get into it. This is going to be a little bit longer of a one here because this is pretty dense stuff here. There's a lot of information. I'll try to make it as quick as possible because yes, there are two distinct types of plans that work to cover that 20% of out-of-pocket costs for medical services that original Medicare does not cover. One's called Medicare Advantage plans. These were born in 2006. They did not exist before 2006. The other is called Medicare Supplement or Medigap plans. Most people just call them Medicare Supplements these days. They're the same thing. You might hear me refer repeatedly to MedSup. That means a Medicare supplement. They work very differently from each other. So let's take a look at those differences. With a Medicare Advantage plan, it turns your Medicare into an HMO or PPO. And the private insurance company, Humana, Aetna, Cigna, United Healthcare, whoever it is that's managing your plan, they become the administrator of the Medicare benefits if you sign up on one of those plans. With a Medicare supplement, again, covers all but 20% of the medical costs. A Medicare supplement is going to cover most of those costs. With a MedSup, the federal Medicare program remains as the administrator of your benefits. So that's an important difference. You've got a private insurance company administering benefits with a Medicare Advantage plan. You've got the federal Medicare program, CMS, administering benefits for original Medicare and Medigap supplement plans. With Medicare Advantage plans, you're always going to have a network of doctors. Like I said, it's an HMO or PPO. So there's a network of doctors that you can see. And if you go to doctors out of the network, then you will pay more out of pocket. Medicare Advantage plans combine parts A, B, C, and most often D, because Medicare C is Medicare Advantage, and Part D was born the same year in 2006. Medicare Advantage plans are not standardized. They vary greatly in how they cover benefits, but they must be at least as good as original Medicare. But there can be a lot of differences in how they cover benefits. With a original Medicare with a Medicare supplement, you can see any doctor in the country that accepts Medicare payments. And that is the vast majority of doctors in the country will accept Medicare payments. With a MedSup, they cover generally 100% of the costs of original Medicare with no copays or coinsurance. Supplement plans are standardized, so they do work the same, from state to state, county to county. They're always going to be the same. And a Medicare supplement plan from Aetna is going to work the same as the Medicare supplement plan from Humana is going to work the same as a supplement plan from United Healthcare. So you really want to look at premiums, what company is going to give you the lowest premiums and what company is going to have the most stable premiums so they don't continue to climb on you. But they do not include your Medicare Part D prescription drug plan. So you will also need to enroll in a prescription drug plan, a Part D plan. And again, Medicare Advantage plans, they combine all of the parts into one plan, which is fairly convenient. Original Medicare plus a supplement does not include the PDP plan. You will have to get a standalone PD plan. There's hundreds of them available. Medicare Advantage plans often include some dental and vision benefits from network providers. Medicare supplement plans do not include dental and vision, so most folks on a supplement plan have a standalone dental and vision plan. Medicare Advantage plans have co-pays for office visits and services such as urgent care, emergency care, hospital stays, and skilled nursing stays. With a good Medicare supplement, there are no co-pays or co-insurances. It covers the 20% of hospital and doctor's office services that Medicare alone does not. And finally, Medicare Advantage plans also often contain extra benefits, things like gym memberships, sometimes a stipend for over-the-counter items, over-the-counter drugs. Possibly sometimes people can even use that over-the-counter stipend for groceries for themselves and even pet food. So that's kind of a nice benefit. Again, though, important to note that Medicare Advantage plans are not standardized. They can vary from zip code to zip code, and they can change the way they cover benefits on a yearly basis or be wholly removed from a zip code or a county, leaving beneficiaries to find a new plan for the coming year. That was a big deal in California this year. A lot of people, a lot of the Medicare Advantage insurance companies, even the big ones like United Healthcare, pulled a lot of their plans out of a lot of counties in California. And so a lot of people were scrambling during that Medicare annual enrollment period to find a new plan. Traveling is a big deal. So on a Medicare Advantage plan, when you're traveling, it's limited really only to emergency services. And even then, what's going to happen, like I said, the differences in the way they cover things and bill things are so significant that you're generally going to come away from like an emergency room visit with a bill in your pocket that you're going to have to submit to your Medicare Advantage plan company and hope that they pay it. Again, Medicare supplements are standardized. They work the same from state to state, county to county. So if you summer in New York and winter in Florida, your Medicare supplement is going to cover your doctor's office visits and all of your medical services the same way it does in New York as it does in Florida. They're standardized. They are the same from state to state. Coverage while traveling, it's there because it's standardized. So as long as the doctors accept Medicare billing, you don't have to worry about it. You don't see a bill, you don't have a copay, you don't have coinsurance. Excuse me. Medicare Advantage plans can have low or no monthly premiums, which is pretty nice. Medicare supplement plans have monthly premiums of generally in the neighborhood of $100 to several $100 per month. Medicare Advantage plans are not medically underwritten. Enrollment is guaranteed for all eligible individuals with Medicare Part A and Part B. Even these days, people that are on dialysis and have kidney failure, they can generally get on a Medicare Advantage plan. Original Medicare, the Medicare supplements are medically underwritten, but you generally have a one-time guarantee issue during your initial enrollment period. So that's important. That means that you can get a Medicare supplement guaranteed issue. They can't say no to you during that initial enrollment period. And go back and listen to the video, watch the video about the enrollment periods to find out more about that. So what's right for you? When it comes down to it, there's no one plan that's better than the other. It comes down to what is the plan that's right for you. If you can't afford the monthly premiums for supplement and dental vision and standalone PD plan, then without a doubt, a Medicare Advantage plan is a great way to go. If you don't travel outside of your local area often, Medicare Advantage is fantastic. If you don't mind being limited to network doctors and facilities, then Medicare Advantage works. What happens sometimes, though, it's important to note, is that a lot of times the Medicare Advantage plans will contract with physicians groups like Brown and Tolan and things like that. And those are the doctors that you go and see. And then after a year or two of working with that Medicare Advantage plan, that physicians group decides that they don't really like the billing and the way that the Medicare Advantage plan treats them as providers. And so they say goodbye to that Medicare Advantage plan, and you're going to have to find new doctors again. And then just remember that you will have copays and coinsurance when you're receiving services. And Medicare Advantage plans, boy, I tell you, all those extra benefits that a lot of them have, those can be a real big deal for folks. And so if you've got a need for some of those extra benefits, Medicare Advantage's plans can be very helpful. Original Medicare with a supplement, you got to be able to afford the monthly premiums for the supplement first off. And if you travel frequently out of state to see family, or you're like I said in the example, you summer in New York, winter in Florida, or summer in Washington and winter in San Diego, then certainly a Medicare supplement is something that you're going to want to think about. And, also those who want the freedom to see any doctor or specialist in the nation that accept Medicare payments, big deal as well. And remember that on a good Medicare supplement, there's no copays, no coinsurance. You never see a bill. You never receive any paperwork. The supplement just pays for the things. Usually quarterly, you're going to get a statement from them saying like, oh, here's all the visits that you had with the doctor and everything you had done this quarter. And here's what we paid for it. But you didn't see a bill. You didn't pay a dime because you're paying your premiums on it. And, if you don't want the extra benefits from a Medicare Advantage plan, then certainly Medicare Supplement is the way to go. A few more details on Medicare Supplements here, and then I'm going to give you a few more details on Medicare Advantage plans too. There's several different levels of Medicare Supplement coverage. K and L, these are plans that you will have a lower premium on it, of course, but when you go in for services, you're going to end up paying a lot of money. So those are really for people with significant medical savings accounts, and they have a lot of money that they can pay for the services. Plans K and L work pretty good for that. Plan G is by far the most comprehensive plan. It covers everything except your Medicare Part B deductible and your monthly Medicare Part B premiums. So very comprehensive plan. Again, you just don't see bills. You don't have copays, coinsurance, or anything like that. Medicare Part D, very close, but it does not cover what we call Medicare Part B excess charges. Doctors may charge up to 15% above what the Medicare reimbursement rate is for a procedure. And if a doctor does charge Medicare Part B excess charges, you'll be on the hook for those excess charges on Part D, but not with Part G. And then Part B, very close to Part D, but does not cover the skilled nursing coinsurance, and Part A, even not quite as robust as that. So you'll pay lower premiums, but you'll pay a little bit more for services. Important things, very important when you're looking at Medicare Advantage plans. Number one, the MOOP, the maximum out-of-pocket, the yearly maximum out-of-pocket expense varies from plan to plan. Some plans have very low maximum out-of-pocket limits of like $1,000 in a year. Some have very high maximum out-of-pocket limits approaching $10,000 a year. And so The example that I use to demonstrate that is your worst health care year yet. You get hit by a bus, okay? You're in the hospital for a couple weeks, need several surgeries. You then go to skilled nursing for maybe a couple months, lots of physical therapy and things like that. Um, on a Medicare Advantage plan, the MOOP is the maximum you will take out of your pocket after you get hit by a bus or have these surgeries, et cetera, before you hit what they call catastrophic coverage, and the plan is going to cover 100%. So, very important to look at the yearly maximum out of pocket, the MOOP, and get on a plan that has a pretty low one, because when it comes down to it and you do have health problems or get injured, that MOOP can take a lot of money out of your pocket if it's not very low. Couple examples. I use my folks, my dear old folks. My mom just passed away in 2025. My dad passed away in 2022. My father had a 15-year battle with melanoma. Both of my parents were on Medicare Supplement Plan G with a standalone prescription drug plan. So my dad had a 15-year battle with melanoma. He was able to see any melanoma specialist he wanted in the country, and we were able to get him into a special university program where they were studying people, because after they found out about my dad, and they're like, he's had how many melanomas cut out of him? You need to bring him in here so we can study him. And he got a much higher level of care and service from that special study group that the doctors were running. And they were all very much, melanoma researchers and specialists. And so he probably went to see the doctors in the program about once a quarter, and probably twice a year for quite a few years. He was getting, melanomas just cut off of him. They kind of call it the death of 1,000 cuts, because they're cutting little melanomas out of you, almost every time you go in to see the dermatologist and the melanoma researchers. Every single time that he went to have one of those melanomas cut out, that would be an outpatient surgery procedure. That would have been a copay on a Medicare Advantage plan. He never had a copay for any of those procedures. He was in skilled nursing for about a month before he passed away. And again, no bills. Billing was coordinated, so we never had to look at any bills, never had to worry about receiving any bills. And again, on a Medicare Advantage plan, there would have been co-pays for all his doctor's appointments. There would have been co-insurance and co-pays for some of those procedures. And he would be limited to network doctors, so he wouldn't have been able to see the doctors in that university research program. So that's a benefit to Medicare Supplement. And then with my mom, a little bit different, but my mom went legally blind from macular degeneration by age 75. And for many years, she was going, I think, once every 2 to 3 months to have injections in her eyes to try to stave off the blindness. And she never had an out-of-pocket cost or a copay for any of that. She was able to see any eye specialist that she pleased, as long as they accept Medicare payments. We never saw a bill, never paid a copay. At 89 years old, my mother broke her hip and had hip replacement and a lengthy stay in skilled nursing for physical therapy. Again, she was, in my opinion, not ready to leave the hospital, but they do not keep people in the hospitals for long at all these days. Even an 89-year-old woman with severe osteoarthritis and a hip surgery, she was out of there and into skilled nursing in 5 days. Surgery was performed by the specialist of our choice. We got the best orthopedic surgeon in our county to perform the surgery, and it was covered at 100%. Never saw a bill, never had a copay. On an Advantage plan, each injection in her eyes would have been a copay for an outpatient procedure. She would have been limited to in-network specialists. Those shots, the prescription drug shots, those cost it a few bucks. You want to make sure that you've got a good plan that covers those. She did. And then, you know, it's likely also that when she went for the hip surgery, that would have been an inpatient hospital stay and procedure copay. And she was in skilled nursing for quite a while. It's very possible that she could have had some significant copays for the skilled nursing and some of the physical therapy. So again, one plan is not particularly better than the other. The question becomes, what is the right plan for an individual and their specific circumstances? Both plans can have substantial costs to them. With a Medicare Supplement plan, you're paying the costs up front in the form of pretty significant monthly premiums. With a Medicare Advantage plan, you're paying the costs on the backside when you receive services in getting copays and coinsurance. If you want the freedom to see, the hotshot specialist at the Mayo Clinic for your specific condition, then Medicare Supplement is definitely the way to go. Medicare Advantage, you're going to be limited to network doctors. And then remember the travel deal. If you move out of the service area for your Advantage plan, you're going to have to find another Advantage plan to cover yourself in your new residence. And if you travel frequently out of your service area, you can have some problems with the coverage when you're out of your service area. So again, best thing to do is work with an experienced Medicare professional such as myself and Reduced Risk Retirement Solutions. There's no charge for our services. We're a broker. We're fiduciaries. We're bound to research and find the best Medicare plan for your specific situation. We're not obligated to enroll in any company's specific plan, and we act as an advocate on your behalf if you have any problems with your Medicare plans. Thank you. There are 3 videos about Medicare up on the website and on our YouTube channel. I cover all of the enrollment periods and how to avoid penalties. We talk about all the parts of Medicare, what they cover, what they cost. And this video, the very important discussion of the differences between Advantage plans and supplement plans. So watch all those videos and you will know more about Medicare than probably 85–90% of the people in this country.